If you've been told that your cholesterol is creeping upwards and you're trying to solve it or address it naturally, you've probably wondered, is there a supplement that actually makes a difference? In this video, we're going to look at what the evidence actually supports when it comes to lowering cholesterol naturally, and how to think clearly and organize the top options that are available without the hype and without the guesswork. I'm Dr. Kenny, a functional medicine practitioner, and every day I help people sort through conflicting health advice with a steady, evidence-informed lens. If you like these evidence-based videos that help you sift through the wellness noise out there, let me know by hitting the like button and I'll do more videos just like this. So let's walk through what rises to the top when it comes to lowering cholesterol naturally. When cholesterol starts to trend upwards in this paradigm, we often look for one single solution. Instead of thinking in terms of the best supplement for cholesterol, it's often more useful to understand the handful of options that are available when we're discussing this clinically, because cholesterol is way more than just a single chemical process. For this video, we're going to be most concerned with LDL, the quote-unquote bad cholesterol, HDL, good cholesterol, and triglycerides. And the goal when talking about supplements is to honor the nuance that is involved. Each of the supplement tools that we're going to discuss works at a different checkpoint in the process of cholesterol synthesis or absorption or removing it from the body. So it's important to remember that cholesterol itself is not just a single number. Cholesterol represents a pattern of interconnected chemical reactions that manifest as the numbers that we see on common lab results. So let's start with the supplement that's perhaps most widely known when it comes to cholesterol, and that is omega-3 fatty acids. Omega-3s are perhaps most well known for their effects on triglyceride numbers. And triglycerides tend to elevate when inflammation is a part of the picture that's affecting the chemistry underneath. Omega-3s are healthy anti-inflammatory fats, which is why they work so well on triglycerides. When it comes to LDL, the results are sometimes more mixed depending on the study that you look at. But overall, omega-3s play a key role when we look at the total lipid profile, especially when triglycerides being elevated are part of your context. You can of course find omega-3s in supplement forms, and you can find them in foods like salmon, trout, chia seeds, and flax seeds. I generally recommend starting with a food first foundation because aside from the omega-3s themselves, food sources also give you additional compounds that work alongside omega-3s for a more balanced lipid profile. When I leverage supplements clinically, I'm not asking, does this fix everything in the exact same targeted way that, let's say, a medication does? I'm usually asking, where in the lipid profile does this supplement fit into this deeply interconnected web, and how can it influence it positively? So let's move on to a nutrient that affects LDL a bit more directly, and that is fiber. Fiber works a bit differently, and it comes in two main forms: soluble, or able to be dissolved in fluids such as our blood, or insoluble, doesn't often cross outside of the digestive tract. Fiber can not only bind to cholesterol that is found in both of these areas inside the digestive tract or the bloodstream, for instance, but it can also indirectly influence how much cholesterol your body produces internally, which takes place in the liver. Fiber is one of the food foundational tools that show up again and again in the research for benefits in many body systems. And the benefit here goes far beyond the number of your cholesterol, LDL, HDL, or even triglycerides. Fiber interacts with your digestive functioning, your gut and microbiome signaling, and broader metabolic hormonal signaling throughout the body. The research shows across multiple clinical trials that adding more soluble fiber shows a modest reduction in LDL cholesterol levels and total cholesterol. And this is one of the longest studied patterns in nutrition research. How much you need depends on your age, your biological sex, but starting with about 25 grams per day is a bare minimum I recommend with my patients, often upping that slowly to 35, 45, even upwards of 65 grams in some cases. And the biggest picture principle here is try and get as much of that fiber from whole food sources. Because for instance, an apple doesn't just give you fiber, it gives you vitamin C, bioflavonoids, phytonutrients, and other antioxidant compounds that work together across multiple systems to take the pressure of stress off of the body. When we isolate nutrients and look at supplements, for instance, we often lose context when we're talking about single ingredients having actions. That's where the whole food approach matters. Next, let's narrow down and talk more specifically about a particular fiber supplement that is often seen in the research, and that is psyllium husk. Psyllium husk is a concentrated form of soluble fiber. It's often used in a powder form and mixed into smoothies or oatmeal or similar. And what makes psyllium so useful in this context is that it binds to cholesterol in the digestive tract and escorts extra out in the stool. This binding effect is why it's used so commonly in over-the-counter products to help bring balance to the cardiovascular health at large. Typically in the research, the amount that one takes stays in a pretty relatively low range. But even still, adequate hydration matters. Because psyllium husk increases the bulk content of your stool, water and hydration matter very much in order to avoid digestive discomfort such as constipation. Now that we've discussed a couple layers of fiber, let's move into a new supplement category that works at a slightly different checkpoint in cholesterol, and that is plant sterols and stanols. Both plant sterols and stanols work differently by competing with cholesterol for absorption in the digestive tract. It essentially limits how much dietary cholesterol is intaken through the circulation. These supplements are typically taken in divided doses throughout the day so that they have a longer lasting effect as we eat multiple times a day. Plant sterols and stanols are one of the most established nutrients in the research to help lower LDL cholesterol levels. And it's been around long enough in the research in randomized controlled trials to be a well-established intervention. Through a lens of absorption versus production versus clearance, plant sterols and stanols stand very much in the absorption lane. And by the way, if you're one who likes the research, I've included a free research summary for some of the articles I used to create this video. You can check out the resources. It's in the pinned comment and the description below. And now let's talk about a botanical option that I find very promising that's emerging in the research, and that is bergamot extract. Bergamot is a citrus-derived extract that has been studied for its favorable effects on LDL cholesterol and triglycerides. It appears to affect how cholesterol is synthesized in the body, as well as processed in the body, which places it in a different category than both fiber and plant stanols and sterols. This emerging data is quite promising, but it doesn't have the same level of depth as fiber or plant sterols and stanols, for instance. But for certain lipid patterns, it may be a very excellent lever that you can pull. When tackling elevations in cholesterol, it's important to avoid the black and white discussions and to ask more detail about which of the mechanisms might be more relevant to your elevations in cholesterol. Even with all 5 of these options that we explored, something I always like to recommend with my patients is that we still rely on a food-first foundation. When you consistently include fruits, vegetables, whole grains, beans, nuts, and seeds into your diet, you naturally bring in the fiber and the minute little plant compounds that support cholesterol metabolism. Supplements are exactly what the name implies. They should often be supplemental, intended to move the needle in a big way because they are more concentrated than food sources, and after making those shifts, replacing it with the food foundations. If you've tried a supplement and thought, why didn't this fix this? It's often because it was layered onto an unchanged foundation or your individual mechanism wasn't targeted. Because the deeper question here isn't just what supplement will lower cholesterol. It's what functions are shaping the pattern of cholesterol overload to begin with underneath. And cholesterol doesn't move in isolation. As with many other symptoms and lab markers, it reflects how your body is handling energy, inflammation, and your metabolic signaling over time. So while targeted tools can help to shift specific end-stage markers like LDL, HDL, and triglycerides, the deeper layer on the other side is focused on regulation. What's being absorbed, what's being produced and created, and what's being cleared. This way of thinking starts to honor the dynamic relationships and the way that we think about creating and influencing health as a part of this deeply interconnected functional network. And that larger system is where the next step of clarity often lives. Now that you've seen how some of the supplements that we talked about today can shift cholesterol markers, the next layer is understanding why those markers shift in the first place. Very often, rising cholesterol patterns are tied to a combination of insulin resistance and signaling and metabolic or energy production regulation underneath the surface. And that's exactly why I did a deeper breakdown of both insulin resistance and fatigue and low energy. Check out that deeper layer here in my next video. Again, I'm Dr. Kenny, Root Cause Health Detective. Thank you for watching, and I'll see you in the next video.